A new bill was introduced last week in the U.S. House of Representatives. The Improved Mental Health Outcomes for Patients Act would provide programs providing care and treatment for mental health, substance abuse, and suicide prevention, including the Zero Suicide Program. Now, that bill has bipartisan support, with 2 Republican senators and 2 Democratic senators putting their weight behind it. Kansas Representative Sharice Davids is one of those backing it and helped introduce the bill. KCTV 5 reached out to her for a statement, and she says we need to be paying attention to mental health. This is not a partisan issue. It's about preparing our healthcare workers with the best possible tools to save lives. Now, because of this new legislation, we felt the need to bring in someone who can weigh in on suicide prevention, as well as what the Zero Suicide Program can actually do. And that's why Dr. Joan Duwve is here with us this morning. Thank you so much for joining us.
Thank you for having me.
This is such an important topic. Talk about some of the warning signs of suicide risk.
Yes, it's a really important topic for Kansans because the suicide rates here have increased 65% over the past 20 years.
Wow.
And on average, we lose about 10 Kansans every week to suicide.
Wow.
Yes. So warning signs that everyone should be familiar with. If someone is talking about not wanting to live anymore, or that they'd rather be dead, if they're sleeping too much, if they increase their use of substances like drugs or alcohol, if they are become anxious or agitated. Those are some of the important warning signs of suicide.
So what do you do if someone tells you they're thinking of suicide?
So actually, the Suicide Prevention Lifeline has a great website. It's BeTheOne2.com. And on that website, they suggest 5 things. One, and the most important thing, is ask the question. So the way we can ask is, you know, have you been thinking about suicide, or is suicide something that you have thought about? Or are you hurting right now? And how can I help you? And asking that question actually starts the process of becoming connected to the individual and gives them permission to respond. Once you've asked the question, simply be there for the person. Be there, you know, if you're unable to be there, make sure that you ask who could be there with them. Don't promise to do something that you can't do. Right. But being there, that connectedness actually is a buffer against progressing from a plan to actual suicide.
Let's talk about this zero suicide. Why is that so important?
Zero suicide is really critical. What we know is that the majority of patients who actually do die by suicide have seen a healthcare provider within the past year. There's still a lot of stigma around suicide, right? With suicide is really brain health, mental health, is suicide prevention, and very connected to physical health. Yet will very rapidly take a blood pressure or check your weight or your pulse, but we don't ask about suicide and suicide risk. So what Zero Suicide does is it's transformational for healthcare systems. It helps healthcare systems, behavioral health and physical health systems, actually take the steps to engage in that conversation with individuals who are at risk for suicide, and hopefully prevent that progression, providing those warm handoffs.
It's such an important topic, and we will have much more about this topic on our website, KCTV5.com. Dr. Duwve, thank you so much for being here today. Now, we've had the number up on our screen during this interview, but we want to highlight it again. If you or a loved one is having thoughts of suicide, the National Suicide Prevention Lifeline is 1-800-273-8255. And in July, that number will change to just 3 digits, 988.